Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping membership medical practices grow and thrive. Hosted by Stephen Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge and DPC practices succeed. Here's Stephen Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Stephen Schwartz. It's my pleasure to have you along on our journey today. I'm really excited for our discussion today. Dr. Tami Singh, her practice is called Aspire Health Direct Primary Care, and she's located in Plantation, Florida. Tami, welcome to the podcast.
Thank you, Stephen. Thank you so much for having me on. I'm excited to explain my story.
Wonderful. Thank you. As the podcast has so many valuable things that we can add to the body of knowledge for folks in DPC and concierge or membership medical in general. And we have folks who are not just medical practitioners, but also business owners and those that offer services and other technology for our space. And it's such a pleasure to pull all these folks together in this podcast. And there's always something for everybody in here if you dig far enough. So again, Tami, thank you for being here today. Why don't we just go ahead and get started? Tell us a little bit about your background, where you grew up, where you went to school, just kind of the early years, please.
Yeah, so I was born in New York and Brooklyn, grew up few years in Long Island. And then when I was 6, my parents moved to South Florida in Miami. And I went through elementary, junior high, high school, Miami, ended up going to University of Miami for undergrad. Unfortunately, did not get accepted to any medical schools in Florida. I kind of closed my view on interviewing at other places or applying other places because I thought I would get accepted in Florida. And I had no family members in medicine, so it was just me kind of figuring things out on my own. And then I ended up going to Ross University in the Caribbean. I didn't want to waste time. And it got me to become a doctor. And I did my residency at USF in Tampa, Clearwater area. And I kind of still stayed in Florida, but ended up on the West Coast. And I got stuck there after because I got a great job with a physician-owned group, Clark and Daughtry. And we'll probably get into that more later about how I transitioned into where I'm at now.
Yeah, what a great story. And where was the school in the Caribbean?
It was Ross. It was in Dominica, and now it's not there anymore. It's in Barbados. It's one of the, I would say, the longest standing Caribbean school. One of them, it's been around since 1978.
Beautiful. I love going to the Caribbean. My wife and I try to get on a cruise ship as often as possible. And whenever we get a chance to get down into the islands, it's always just such a different pace. The ability to focus on medical school, studying tests and everything in the midst of having these gorgeous beaches right outside your window, perhaps. Kudos to you for sticking to it.
Yeah, Dominica is very different than the other more, populated islands. The school was in a very deserted area, so you really only studied, but you had definitely just adventures with diving. I got certified diving and, hiking, and it was beautiful, beautiful terrain, but no fast food, no movie theaters, no shopping malls. So it was definitely a focus on medicine, and it was a great place to do your medical book work, and came back to America and got to do all our clinicals.
Wonderful. Yep. And I've been in Florida now since about 2002. We have some family outside of the Tampa area. I'm located in Vero Beach, Florida on the Atlantic coast, and we love it here. It's just a great little town. But as we said, it's always fun traveling and seeing new places and having new experiences. So on your story, you said you went to school in Tampa, residency at UCF, you said? USF, South Florida. And what happened next with your first job? How did you get your job? How did you apply? Talk us through that.
Yeah, so I went through some recruiters that were trying to help me find places because I actually wanted to come back to South Florida. And that wasn't looking very promising because I didn't speak Spanish. And the salary that they were offering me in South Florida versus the salary they were offering me in Lakeland, Florida was very different. And it was a multi-specialty group. It was physician owned, which was amazing. And I took a jump and I was like, what? I'll figure it out. Let's see, my first job. And they actually say, like, your first job, you don't stay more than a few years, like, and you're still trying to figure things out. So I took it. I actually was there a lot longer than I anticipated, but they really allowed us to be physicians and practice the way we wanted to, which is what a lot of us want to do. And unfortunately, the hospital took us over. And when the hospital took over, that was when I was like, this is not going the direction I want to. They were telling me I had to reach a certain quota of patients and changing my levels and just doing a lot of things that I didn't feel comfortable with. And that's when I ran into DPC, and I went to the AAFP, had a conference in DC in 2017 in Washington it was called DPC Summit. And I went and I took my dad, my brother, and my mom, because it was my brother's birthday weekend. And I was like, just come, I'll go to this conference. You guys will hang out. And so happened, I pulled my dad into one of the lectures and I was like, just listen, that's all I want you to do. And we walked out and he was like, are you crazy? No insurance? Like, this just doesn't make any sense. Who's going to come and pay you when they can use their insurance? And I was like, hey, I really want to practice medicine this way. I think it's going to make me enjoy it more. It's going to give me that drive that I don't have anymore because I was so bombarded with paperwork and numbers and rather than patient care. And so he's like, what's going to happen? A year, give it. If it doesn't work out, you'll go work for somebody else. And I just needed that support system. I didn't need it financially or anything else, but just the support of, I am behind you. I don't think it makes sense, but sure, whatever. It's a crazy idea and go ahead for it. So 2017, put my paperwork in, quit my job, moved back from the West Coast to the East Coast of Florida that nobody knew me. So this was a very enlightening experience of like, well, how do I market myself? How do I build a name for myself when nobody knows me? I was 4 hours away. And so that's how I ended up opening up a DPC practice. I was fortunate to find a space it was a plastic surgeon who was renting space and actually took a chance and said, okay, I'll give it to you for a year. And so that was very nice of him as well. And it was fully furnished and I just had to show up. And so I opened doors November of 2017. And now we are about 9 years later and we're going strong. And we would love to expand even more.
Right. And from your website, you have a partner. You want to tell us about your partner?
Yeah, so she has been now with me for 2 years. We brought her on. Prior to her, there was somebody else that was a hospitalist, and it wasn't a good fit at that moment anymore. So she was leaving. Dr. Falden was coming on board, and it worked out. She kind of absorbed her patients, and right now I have a wait list, so I'm trying to funnel my patients to Dr. Falden. We're also looking for more physicians to come on board because we are growing. We're looking to open more locations if we can, but again, this model is growing and I'm excited for where it's going in the direction, because when I started the DPC model, there was only 2 other physicians doing it in Broward County. Now there's so many other doctors doing it. It's just growing every day, the membership model. So I really think it's the way to medicine.
I love it. You mentioned how the big hospital system started buying up the family practices. Here in Indian River County, a couple hours north of you, Cleveland Clinic came through several years ago and, bought the hospital and tried to get that turned around, and then started buying up the little practices as well. And as an outsider, I saw quite a few practices that were owned and run by friends of mine, and they kept working for 2 years. And then as soon as the 2-year mark was up, they dropped out and started their own practice elsewhere. And so now we have a bunch of concierge practices in our county as well. But it's so often we're hearing that the practitioners went to school and their love and their passion is to provide excellent medical care to their patients. And when they're forced to meet quotas on the number of patients you have to see in a particular day, if you just simply do the math, you don't have enough time to really dig into the situations and the backstory of your patient. And before you know it, a 3 to 5, 7-minute encounter and prescribe a Z-Pack and get them on the way because you got 3 more people, waiting for you. It's not enough time and people can miss things. We are all human. And beyond that, our practitioners are burned out. So many folks I've talked to in my career working in this space where they're almost to a point of like, forget it. I'm going to go, I don't know, like you said, teach people how to scuba dive. It's like, you went to medical school. You want to go have a business teaching people to scuba dive? Yeah, that would be fun.
Yeah.
And so I love that membership medicine is helping our practitioners be relieved of a lot of the stressful things that corporate insurance-based medicine has, let's say, foisted upon them to work within that model in that space. And through membership medicine, they're really getting to enjoy what they do again. And I assume having much better results and outcomes for the patients. What do you think about that?
Yeah, definitely. I spoke to an individual today on the phone who she went to see one of my colleagues who takes insurance. She's a GYN, and she's like, I was like, how was your experience? She's like, oh, the GYN, she was great, but our office, like nothing can get done. Like the staff, just everything. It's so tedious to ask for things, or people call you back, or, I know a lot of people have this dilemma about saying that medicine is customer service, but I think there's somewhat of some customer service there that I provide my patients, where I want to make sure they're happy with their care, just as if I went to a doctor's office, I wanted to be treated this way.
Exactly. And, under the DPC model and the concierge brand, the idea that we're treating patients better, we're giving them more time, we're giving them our ears and our brains and our ability to truly take the time that we need and help get to the bottom of the medical issue or the emotional issue or something that's going on there. And through that relationship, people feel loved, they feel appreciated, and they become a raving fan of your practice. And it is so important, as you just mentioned, to have a successful practice is to have from every encounter, from people finding you on the web through a Google search or an AI search or something, to coming to your website, to feeling good and welcomed through the website, to communicating and getting their meet and greet appointment set up, the actual meet and greet discussion, their first clinical appointment, and just loving on them all that time, again, turns them into raving fans. They're going to love you. And these type of people will stay with you if you treat them right, correct?
Correct. Yeah, these are your biggest fans, your marketing tool. They are the ones that are spreading that word around the community for you and writing good reviews that also help you.
Absolutely. You talked about having a wait list. So your panel is totally full now?
Yes, my panel is full, but like I tell the patients that I have meet and greets with, you have to understand that I only want a certain number of patients to make sure that I am taking care of myself. I'm not overbooking myself in a day, where if my patient was to call me and something was happening and my staff would tell me, I can jump on a call and not feel burnt out. Like, oh my God, I'm here till 6 o'clock at night answering calls or messaging people. So I want to make sure I have safe space in my schedule to accommodate my members. So that's why I have a waiting list. So I try to explain that to them, and they're very receptive. But I also tell them, if you want a sooner appointment, Dr. Feldon's just as amazing, and I would highly recommend her.
Excellent. And help her grow her panel to the level she wants to or needs to be at. And then obviously continue to bring on the next practitioner, fill up their panel. Do you mind me asking what your panel number is and where you found you're comfortable?
Yeah, I'm at 430 right now. I thought I was going to be comfortable at 500, but I also do functional medicine. So functional medicine patients, their first visit is 2 hours, whereas traditional patients, primary care traditionalists, 1 hour long for their first appointments. So it's a little bit more in depth of functional medicine. So because of that kind of overlap and that mix in my panel, I decided that was a good number for me. But I'm opening up as I go, like in the future months, like in July and maybe September, I'll find a spot here and there. I might add people in somewhere if it's reasonable for me.
Sure. That seems like a pretty strong number. I mean, many of the folks I talk to on the lower side, maybe 250, and 300 seems to be a very nice number for a lot of folks. Again, we have to discuss so many items, so many criteria for how to determine what a good panel size is. How much time do you need to spend with your patient? How much do you charge? How much do you need to earn as a business in order to cover all of your expenses, put away some profit, and to be able to have the lifestyle that you need? And so many different numbers. We actually put together a spreadsheet that we offer to folks if they want to grab it from our webpage of resources, where you can literally put in how many I have in my panel now, how many is my desired panel, what do I charge per patient per year, how many leads do I get per month, what is my conversion percentage, and so much more, so that you can really chug your own numbers and figure out, wow, I really need to charge more per month, or I need more patients, or I need whatever it might be. So a great resource that a lot of folks have utilized that I've shared with them. As a DPC practice, different practices handle labs and imaging and medications differently. How does your practice handle those?
So for self-pay patients, we offer client billing for that. They can either do it in our office, there's no extra charge for them, or they can do it at the actual lab. And then in regards to the ones that have insurance, again, they can come in our office, no charge extra, or we give them a lab order and they go elsewhere to get it done. And in regards to the imaging, we have local imaging places that have dropped by pricing for us, so we can notify our patients upfront, this is the self-pay rate, versus if they wanted to go through their insurance or not, they had that option as well. And then medications, we have some limited medications in the office that we prescribe to our patients. We have a dispensing license. However, a lot of our prescriptions, we just send it to the pharmacy. Patients can use GoodRx. We educate them about that and coupons. So we're very knowledgeable and try to help navigate them with that. So in our practice, though, we also are very heavy on our staff because we kind of want to do less. So we have 4 virtual assistants, 3 office medical assistants. And so, of course, our overhead is a lot higher than a traditional or maybe a concierge or a DPC doctor that wants a smaller panel and maybe wants to do more.
Excellent. Are you willing to share your pricing model on the podcast here?
Yeah, definitely. And it's on our website. We are definitely transparent. There's no hidden fees with our patients at all. And that's what our drive is as well, to be transparent. So we have $105 is our enrollment fee / appointment hold fee. So the enrollment fee is for our traditional patients. The hold appointment fee is for that 2-hour functional medicine patient. So both tiers have to pay this fee. For the traditional patient, when they come into the office, they will pay their monthly membership. So it's dependent on their age. If they're between the age of 0 to 64, it's $95. And if they're above 65, it's going to be $160. If there was a parent enrolled, a kid's membership is $68. So that's for our traditional primary care. And believe it, when we started 9 years ago, I had $20 kids fees. I had $45, but of course, inflation. And, I did grandfather my patients that started with me for quite some time, I think like 5 years. And, there is still some patients that if they are in financial distress, I wanted to help them out. I will reduce them for a few months or however long to help them out. And they're very loyal to me, and they really value their service. So we really try to help them at the end of the day. And then our functional medicine patients, they actually pay because it's a 2-hour visit. It's a very in-depth visit where we're looking at all their medical records. We're looking at all labs. A lot of times they come with a lot of information. Sometimes patients of mine come with a big folder and I have to review all their stuff. So that appointment is a lot, and it's from the time they were born until now, kind of what has manifested, and we're really trying to get to the root problem. So that appointment fee is, I think, $515. So the $105 goes towards that fee. So we deduct it. So it's like $410 at that first visit when they come to see us.
The thought of people coming in with a big stack of paper and labs and their medical history and spreadsheets and all that is so good. The idea that people taking charge of their health,
Yes.
if you don't make your own health the priority and advocate for yourself, who's going to, right?
Mm-hmm.
And so I love that people come that way. Are you using AI at all to help
Yes.
sift through all of this data?
Yes, we do have an AI system, our EMR actually. If we put it into the system, upload it, they will come up with a summary for us of the patient, which is an
Nice.
amazing, amazing tool to help me. And then again, help our patients better.
Right. Which EMR do you use?
We use Atlas. Atlas is a DPC owned group that they've been around, I think maybe over 10, 12, 15 years. Yeah, they've been the grandfathers into this. Yeah. So I actually, when I was going into or thinking about DPC, their doors are always welcome for questions and advice. So it's very nice that the DPC community is so open, and we would just want this movement to grow.
Yeah, I agree. Last few years, I've attended the Concierge Medical Forum, Michael Tatro's organization near Atlanta. And it's been such a wonderful conference to attend. And same, obviously, there's things in common and things a little different between Concierge brand and DPC brand focus. But I was so amazed and encouraged by how kind, how open and giving and sharing the folks in this community are with each other, because they all, understand that the rising tide raises all ships. It's not just a silly cliche, but it really does help. And if I, through my medical practice, can help 10 other people with their medical practice, you've got happier practitioners, more successful businesses, lots and lots and lots of successful, happy, healthier patients. Everybody wins.
Exactly.
Such a great thing. So we talked a little bit about growing panels and, for you reaching your magic number that you're comfortable with. And this is the Concierge Medical Marketing Podcast, and we do want to talk a little bit about marketing. What marketing techniques have you tried in your practice that have worked well? What lessons have you learned? And if somebody's listening to this podcast and says, hey, I'm starting a practice, I only have 10 patients or 0 patients at this time, what advice might you give them on how to properly market their business, perhaps on a shoestring to start, or more advanced when you actually have some money to invest in it?
Yeah, so I definitely give the advice for those who are thinking of concierge or DPC and they're still in the system to make up your Facebook page or make up your Instagram page and ask, your current patients to write reviews on Facebook or also follow you on Instagram and start building a following. So again, when you decide you're going to leave the system, you have already a following and they know where to find you.
Nice.
That's definitely my advice with that. And that's what I did with Facebook page. I had them start leaving reviews because I knew I was moving to a new location and nobody knew me. So I really needed that, again, validity somewhat from online presence to help me when I did my move. So that was a very, very good idea I came up with. And
yeah, it's very, very clever. We call that social proof. And we, as a marketing agency, you as a physician, somebody else, we can tell people that we're great, but there's no credibility there simply because obviously we're biased, right? But if multiple other people say you're great, oh, well, let's go and work with that person. Let's go talk to them because, well, they're not us, right?
Exactly.
So that's a very clever method. I love it and love to share that with folks that I talk to in the future. What other traditional marketing did you do?
So I also joined the chamber. I wanted to get to know my community, the community that I was going to work in. And so I started volunteering for events. I started setting up my table and learning my 30 to 60 second pitch and just spoke to anybody and anybody that would talk to me. And then I got my scrubs made with my name and I was a selling billboard, I guess I can kind of say.
Walking billboard.
Yep. Walking billboard. Yes,
walking
that's what
billboard.
I meant. Walking billboard. Walking billboard where I would be at Publix or I would be at a coffee shop and I had my scrubs on and I didn't have patients at the time, but I was marketing myself and I would talk to people and, get to know them. And that was me kind of planting the seed. And years later, somehow we would meet again. And I remember I met you. And it's such a small community that it was very nice that I was able to get to know the community from that.
Nice. Did you do any other marketing like Google Ads, SEO? Tell us about
So
that
I
experience.
I did Google Ads, but I didn't really see very good benefits personally. And eventually, when I spoke to a web designer, he's like, "This isn't working for you." So he helped with the SEOs and things like that, and he kind of every couple months we'll revisit things and he'll change some SEO stuff. But I got like a Google QR code for our office, and we would my staff would encourage our patients, if you had a good experience, please leave a review. And so the reviews have definitely helped. We have over 300 reviews. We're 4.9. So for a doctor's office, this is pretty decent amount of reviews. So
Definitely.
we're trying. We've been a lot of patients, and I've made a spreadsheet from the time I started that you mentioned, like to find out about your how many patients you're keeping, how many patients are canceling. So I keep that, and where did they find us from? When they fill out on our website for a meet and greet, it asks, where did you hear about us from? Did you hear Google? Did you hear from a podcast? Where did you hear about us from? So we try to utilize that for our marketing as well.
I love it. It's so good to keep track of these different methods and find out from technique or method A resulted in this, that led to that, which resulted in so and so amount of income or patients or whatever, as well as when a patient signs up with you, what is the average lifetime value of that patient? In other words, if someone's paying you, what did you say, like 160? So, okay, let's just say $100 a month, and they're with you for 1 year. That's a $1,200 quote value. And if they stay with you 3 years, that's $3,600. Knowing those numbers can really help you as you plan for expansion, growth, or eventually when you want to sell your practice. So at some point, you're going to want to retire. I'm going to want to retire, or whatever may happen. I actually interviewed a gentleman yesterday for the podcast whose business is all about growth, helping practices grow to the level so that they can, when they want to sell, have a 7-figure exit and possibly selling to investors who want to buy the concierge or DPC practice. So always keeping the end in mind when you're building your business, because at some point you're not going to be doing this, right? Whether you're going to sell it to your other practitioners in the practice or an investor or investor group or somebody else, we don't know. But think about those things as you do it, because obviously where you are now and where you want to go, there's things that we need to do in the middle to make that happen. Have you ever thought about how long you want to do this and how or where you may want to get done and retire? I know you're young.
No, I haven't really thought of that yet. I still have like goals and dreams of more. Don't get me wrong, I'm happy, but again, I just love this vision that I have and want to continue. So yeah, I'm not really sure.
Yep. Okay. Well, you're doing great. And your practice started in 2017. I started my first website design company in 1999.
Wow,
And
awesome.
I ran that business until 2024. We had built somewhere over 2,400 websites for small businesses and nonprofits across the country, and did lots and lots of digital marketing and all that. And for me, it was kind of interesting is that I got to a point where I was feeling pulled in so many different directions, and the different technologies and methods that we built in our business were no longer special or unique anymore. And I felt like we got to a point where we weren't, I don't want to say effective, it's not quite the right word, but just nothing special anymore, because you could get websites that you could do it yourself from 100 different sources, and you can get SEO from all these different places. And so with me and my quick personal story here is that after building hundreds and hundreds to, like I said, over 2,400 websites, eventually I sold the business. I sold it to a friend of mine who wanted to grow his similar agency through acquisition. And he and his team had already done a lot of work with many of our clients. So it really made good sense. And for me, I kind of did what concierge doctors do, which is going from a panel of 3,500 patients down to a panel of 300 patients, right? And the ability to spend more time and more focus with each one to help them knock it out of the park. And so I created concierge medical marketing. this digital marketing agency focused on this space of concierge and DPC practices to help them succeed in their businesses. And it's certainly been a wonderful ride, and thrilled to be a part of it.
Awesome.
So that's my quick story. I do have a couple of things I just wanted to mention. With concierge medical marketing, we can help our clients with a transition from a traditional insurance-based practice to a membership. We can help with growth. You already have a growing or existing medical practice with a membership focus, and you want to grow and get your 300, 400 or so patients. We have methods and techniques to help you do that. We can also help with nurture. This is one area that we see a lot of people kind of miss the boat on, which is you need to nurture the people who are already your patients, plus the folks that are on your wait list. You got to keep nurturing them, loving on them, and letting them know that you're here so that when it's their time to join, they're ready, right? So the different things we offer. I wrote a book called The Definitive Guide to Winning with Digital Marketing for Concierge Medical Practices. The book is entirely free as a download from our website, conciergemd.marketing. And if anybody's listening to the podcast and is really considering that they want to jump into having a membership medical practice, whether DPC or concierge, please download the book with my compliments, and I think you're going to find a lot of great value there. I also created a tool called Maddie. Maddie is the AI digital marketing assistant for membership medical practices, and that's also available for free. I put together a website, stephenschwartz.info, and this website has, I don't know, a dozen or more free tools and resources and books and links to my podcast and the blog and all this stuff. All these things are available. Just about everything on there is for free as a way of helping this space, helping folks grow and succeed in their practices. Obviously, if anybody wants to talk to me personally, please reach out to me. The link to schedule a time with me is cmmkg.com/schedule. And it's like a Calendly tool where you pick out a date and a time and it goes on a calendar. But Tami, I've really enjoyed our conversation today. As we wrap up our discussion today, what thought would you have for somebody who's listening to this and maybe they've been in insurance-based medicine for 5, 10, 15 years and they're considering this membership DPCE concierge thing that they keep hearing about? What advice would you give them?
I would tell them if they really want to take charge of their life, being a physician, and practice medicine the way they want to practice it, please. There's so many resources like you, Stephen, that you're doing amazing things to make this easier for us as physicians to take the leap, to take the jump. Again, we weren't taught business and how to run a business, but definitely your tools sound amazing to help others out there to take this leap and know they can do it.
Absolutely. I appreciate the kind words. One of the things that I created is an AI tool that can analyze a practice's website, learn everything they can about the practice, generate a list of, 700 or so phrases relevant to the practice that people might type into Google searching for a service or practice that does that thing. I take that list, I put it into Google's keyword volume tool, and select the geographic radius of the area where the medical practice serves. For instance, if somebody is based in, Sacramento, California, right? We just get all of Sacramento or the county around that space where people are willing to drive to that practice. Or some telemedicine practice like everybody in New York State or whatever it might be. But anyways, taking the list of phrases that people might look for, putting that into the Google tool and specifying the geographic radius, I'm able to see how many people are searching for those exact phrases on average per month for the last 12 months. And simply by looking at that, we can have a pretty good idea if we did a properly optimized Google campaign, will that help them get more eyeballs on their practice and likely more meet and greet appointments? And so, like you said, free tools that are available, that's something that's available for free to help people grow their practice. And we're thrilled to be able to offer it.
Awesome.
So Without further ado, Dr. Tami Singh, it's been my pleasure getting to know you today and letting you share your story. And congratulations on just a great growing practice, helping folks from birth up to seniors and, really everybody in between. Bringing aboard your second practitioner for 2 years now and growing. And, I just expect to see more and more great things out of you and your practice and your team in the years to come. Let's stay in touch, okay?
Yes, definitely. Thank you so much, Stephen, for this opportunity. I really enjoyed it.
Truly, it's my pleasure. And we'll get this launched and published. In fact, folks, if you're listening to this podcast, please like, share, subscribe, repost, whatever you do at whichever platform you find it. Please do those things because that'll really help us share not just this podcast episode, but all the ones before and after so we get the most effective outreach. Okay. Folks, this has been Stephen Schwartz with the Concierge Medical Marketing Podcast, interviewing Dr. Tami Singh. It's been our pleasure having you along on the journey today, and we'll see you on our next episode. Goodbye, everyone.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at
772-304-2420
or visit our website at conciergemd.marketing. We will see you next time.